My goals for today are to summarize the changing state of science basically over the past month using the last town hall as a starting point. And most of that is about what we've learned about this new Delta variant. So to summarize the events of basically the past month as I understand them, case counts in the US, which were at an all-time low since the pandemic began in mid-June, are rising again in all 50 states, including Massachusetts. We'll dig into that a little. This is, in related news, this new, more contagious Delta variant is causing essentially all new cases in the US as of now. It's over 90%, and those data are about a week and a half old at this point. So I think it's fair to assume that almost any new infection is from Delta at this point. We do have some vaccine news against Delta, a lot of that from the UK, and the short version is they look to work quite well. We'll dive into the details of that. And then as Jesse mentioned, there have been new masking recommendations, both from the CDC and the Broad. And that's basically driven by the first 2 points that I discussed here, that case counts are going up and that Delta is unknown, and except that it's more transmissible. And in spite of the third point, the recommendations are to mask. And we'll dive a little bit into the science of that too. So first of all, addressing cases in the US. It's important to note that this is not the same everywhere in the US. So if you look at the country as a whole, cases are about 5-fold up from where they were at their lowest point about a month and a half ago. But they're still 5-fold down from their peak. And by and large, if you were on the street today in like an average place in the US, you'd be about at as much risk of encountering the virus as you were in late April. Massachusetts, where vaccination is quite a bit higher, this is the percent of the entire state's population that is fully vaccinated, not just eligible and not just one dose. 63% of the entire state is fully vaccinated. We actually have a higher fold change since our low, but that's because our low is lower. Our total cases are much lower, and they're still 13-fold lower than they were. And so if you go back in time, you only have to go back to May to get to a time when cases were as frequent. Whereas in another state, not to pick on Louisiana, but it's the state where cases per capita are the highest right now, and it's one of the lowest vaccinated states, their risk is essentially the same as it was at the peak. It's only about 30% lower than it was at its very peak, and the risk is the same now as it was in mid-January. So the landscape is sort of walking around is different than it was even a month ago. And this is in large part because of a more transmissible variant that is spreading. And so we knew this was coming. We saw it in the UK. This is showing sweeps, sequential sweeps of the population. First of the alpha variant, which was more transmissible than what we used to call wild type, which is actually itself a mutant. Now, more mutation led to Delta, which swept away alpha, simply because it's a more fit virus for that population at that time anyway. The US has, I think, predictably followed suit. It's actually followed suit in about the time frame we expected. So over the last month, it's exploded from a minority of cases to the vast majority. This is, as I said, these data are already more than a week and a half out of date, and at this point it was something like 84%. So to restate this, it's essentially just restating what I just said to say it's a more contagious or a more transmissible virus, at least at this point in time, with this level of immunity, with these current behaviors. It has outcompeted alpha and all prior variants. But I think it's important to dig one layer deeper and ask why, because it affects how we deal with it, right? So it could be that it's simply a more contagious virus, that like even in a non-immune population with all the same behaviors, it would spread better than alpha. And I actually think that's the core of the answer as to why Delta has taken over. But an alternative possibility is that it's simply more immune evasive. And so because we have a population with accumulating immunity, it could be that that's the reason it has the edge over alpha. And while there is some in vitro data that it is more immune evasive than alpha, neutralizing antibody titers are slightly lower, I actually think there's good data from a number of sources that most of the problem is it's simply a more contagious virus. And a lot of that comes from the rest of the world where vaccines are not, and Delta is still taking over. But some of it comes from the US too. So if you look at states by vaccine, if you sort of segregate states by vaccination level, so look at the top 5 and the bottom 5, and you look not at case counts, because obviously case counts are higher where there's less vaccination, but the percent of cases that are due to Delta. And even there, Delta took over faster where there was less vaccination than it did where there was more. Now it's everywhere, but it got to the places with lower vaccination first. So that suggests, at least to me, that it has a bigger advantage in populations that are less vaccinated. So I don't think it's the majority of its takeover is because it's easier to get through vaccinated networks. That may be a part of how it still gets around, but I don't think that's the dominant thing. We have other evidence that vaccines still work well against Delta. And some of this is piecing together information from other variants like Beta, which look in vitro to be even more immune evasive than Delta. And some of it is from Delta itself. So the best data I've seen on beta, which again looks in a test tube like it's even more concerning in terms of immune evasion, comes from Qatar, where there was a study of the entire country at a time when about 40% of cases were beta and about the other 55 to 60 were alpha. And the Pfizer vaccine, which is what that country has used predominantly, was still 75% effective against all cases with beta, compared to about 90% with alpha. So it was a little bit less effective, but against severe disease, it was more than 97% effective against all strains that were present in Qatar. Similarly, in the US, the vast majority, the CDC and various other sources are reporting 97 to 99% of COVID hospitalizations since May are in an unvaccinated population. Now that may be before Delta has fully had time to not only take over, but have enough of a lag time to lead to hospitalizations. But for that, we can turn to the UK, where they've studied in quite a bit of detail in work that was just published last week in the New England Journal, showing that all symptomatic infection was protected against quite well by Pfizer. So Delta had a very slight decrease that's not statistically significant compared to the Alpha variant, which has very minimal immune evasion. AstraZeneca, which is the other vaccine they use in the UK, was somewhat less effective against both Alpha and Delta, but the difference between Alpha and Delta wasn't that dramatic. And against severe disease leading to hospitalization, both Pfizer and AstraZeneca were very effective against both Alpha and Delta. So vaccinated people are not winding up in the hospital, even in the UK, where Delta has taken over. And I'll have more data on that in a minute. Just because there were a lot of questions about Johnson & Johnson and the need for boosters. I'll come back to that in detail, but my hunch from what we've seen in other scenarios is that J&J would fall somewhere between Pfizer and AstraZeneca in terms of efficacy. That's what it's done sort of overall, and that's what it's done against some other variants. That's what antibody levels look like. So that's my hunch. But the short version is we don't have a ton of data on that yet. And again, I'll come back to that. But I wanted to drill down a little bit more on the UK because that's where they had Delta first in a place that was well studied and well sequenced. You know, India also had a lot of Delta early and saw very different outcomes on death. But the UK was a very vaccinated population when Delta came through. And two things happened. One is that Delta still spread despite it being very vaccinated. And so if you look at their second wave in December to January, that was mostly driven by the Alpha variant and was at a time when they were just beginning their vaccine rollout. You saw cases, and just like we have everywhere else in the world, at every other time, you saw deaths quickly follow, about 1% the raw number of the number of cases. But in this third wave, by this point, about 90%, more than 90% of the over 65 age group in the UK has been vaccinated. And what you see is cases accumulating essentially as fast as they did in December and January, but deaths not following almost at all. In fact, there's been a barely detectable uptick in deaths due to COVID. So that's reassuring that vaccines do a good job of preventing severe disease, even in those most at risk. But it's really important to remember that this will not be true in all of the world. It won't even be as true in all of the US because the vaccine uptake, even in the highest risk groups, is quite variable from place to place. In Massachusetts, I think it's well over 90% like the UK in the over 65s. In certain states, it's below 80%, and that's going to make a difference in how vaccines translate to severe disease, to hospitalization, and to death. Okay, so coming back to Johnson & Johnson and Delta, there is very little data yet on this, actually. But what I've seen is actually cautiously encouraging. This is from colleagues at Harvard Medical School, Dan Baruch and his group. They've seen, and it's all in vitro. So there's not any efficacy data in terms of case prevention that I've seen for Johnson & Johnson for the Delta variant. But in vitro, there is a slight reduction in neutralization titer against Delta shown here than to wild type virus shown here, meaning it takes a little bit more, your serum is a little bit less able, after you've been vaccinated with J&J, is a little bit less able to neutralize the Delta virus than the wild type virus. But that reduction is relatively modest. It's not a big reduction, and it has corresponded in other cases, like beta has a bigger decrease, and we know that the vaccines work pretty well against beta in preventing cases. So to me, this was quite encouraging, and this is true even 8 months out. In fact, J&J seems to get stronger. Like at a month, these levels were a little bit less good actually than they were at 8 months. But it's important to note that this is in vitro only, and so we still don't have real world efficacy. And it is true that titers of antibodies are better for messenger RNA, that are higher for messenger RNA vaccines after 2 doses than they are for J&J after 1 dose. And it's possible that this might matter more for Delta than it does for wild type or Alpha. I think that whether that translates into a reduction in actual infection, I think remains to be seen, but it's plausible that it might. That said, there are no data that I've seen for the efficacy of boosting Johnson & Johnson with messenger RNA subsequently. There are good data now from the UK about boosting AstraZeneca with a first dose of AstraZeneca with a second dose of messenger RNA. That gives you a more robust boost in antibody titer. These are all target the same antigen, the spike protein. And so I think it's reasonable that it might lead to a boost in antibodies, but we don't have data on whether or not that's true yet. Those studies, to my knowledge, are ongoing. And we certainly don't know anything about how that will translate into actual efficacy. So unfortunately, that's what we're left with. And I don't know that it's enough to make an informed choice. I know people who have chosen to get boosted. I know a lot of people who have chosen to wait for data. I think that I lean towards that second case of waiting for more data. But this is the state of knowledge as I know it. So if vaccines work so well, why is Delta still spreading? I think it comes down to the fact that it's just harder to control a more contagious virus. It takes more things. It would take more immunity if that's what you're relying on. So the herd immunity threshold, which I'm not going to work through the math here, but if you're interested, you can screen grab this and go. And I'll just say this is overly simplified. But if you're relying on immunity, it takes more immunity to stop the spread of a more contagious virus than a less contagious virus. But that's also true of behavioral restrictions. That's also true of other factors like seasonality. And that's true of the mix of them together. Something that's more contagious is going to spread better, even if it's not evading vaccines or vaccine-induced immunity, just because it requires more people to be vaccinated. And so if we consider Massachusetts, we had enough to stop alpha. And actually, alpha cases are continuing to decline. They're not accumulating now. But Delta, because it's more contagious, I think, and maybe because of a small amount of immune escape, has crossed that threshold to where it's able to spread again. Where it goes from here, do we become Louisiana in 2-3 weeks or not, I think is really hard to say. This virus has been nothing but humbling. But I'll say, I think we're going to be in a better case, certainly in terms of severe disease because of the increased vaccination. And I think the solution, whether it's more contagious or whether it's partially vaccine evasive, the solution is still more vaccination. I think that's the best solution to getting this epidemic under control. So again, if vaccines are so good, why are we seeing these reports of breakthroughs? It's because they're not perfect. And so anytime there's more cases, there will be more cases in vaccinated people. In fact, it's more than that. There are more cases than there were a month ago, and there are more vaccinated people than there were a month ago. And so paradoxically, that means vaccinated people are encountering virus more often. And so more often viruses will sort of sneak through. So that explains why you're reading about it more now than you were a month ago. Some of that is Delta, but a lot of that is like Delta immune evasion, but a lot of that is just Delta's effects on cases. And it's important, again, to remember that vaccines remain really good at preventing severe disease. But what about transmission? So transmission from vaccinated individuals. So it's very clear still that being vaccinated makes you less likely to pass on this virus to other people, mostly because it makes you less likely to get infected at all. That's the primary way, and it's still a big deal. It's the biggest thing. If you get vaccinated, what do we know? So we know a lot of things in other settings. We know less about Delta. We know, as I said, cases are milder, considerably milder on average. There's many studies that say that. We know the viral load appears to be lower, although that's mostly from pre-Delta data. There's some rumors about viral load in Delta infected vaccinated people, but no hard data. And I will say those studies are really complicated to interpret correctly. And so I wouldn't put much on anything you've heard. I'm waiting for data there. There are clearly anecdotes of confirmed transmission from vaccinated immunocompetent people to others. That it clearly can happen, it is possible, but its frequency is still unclear. To the best of my knowledge, it remains likely that it's, even if you're infected, a vaccinated person is probably, the best guess is you're still less likely to spread it than an unvaccinated person. It's clearly not impossible. And so it's somewhere in that gray area between, and we're hoping to learn as soon as possible. Next thing there were a lot of questions about were kids and Delta. So it's been true since the beginning of this pandemic. It's been clear that kids do much better on the whole than adults with COVID, meaning they get less severe disease. They are far less likely to die. In fact, their relationship is this striking log linear relationship of infection fatality rate with age. Basically, every decade of life, you're 5 times more likely to die if you get infected with COVID. It is unclear how Delta affects the severity curve. Like Alpha probably causes more severe disease. I think there's the best data I've seen are out of the UK and suggests that Alpha was a little bit worse than wild type, but it basically probably just shifts this whole curve up rather than changing the age relationship. Delta is completely unknown, I would say at this point, but I don't have any reason to think, I've seen no reason to think that it selectively affects kids more than adults in terms of severity. It's important to remember when you're reading about sort of childhood impact in other places, that it's really hard to compare severity across locations and even across times because of differences in hospital capacity and sort of provision of care. And it's really hard to assess rates on kids in the Delta era because the ideal case is comparing people infected with one variant or another at the same time and place. But Delta swept so quickly that there wasn't much of a time when there was some Delta and something else. It's now all Delta. And because severe disease is so rare in kids, there wasn't time to accumulate the number of events at a time when both were circulating. So That means it's hard to know, but it's also kind of good news because there were still really rare severe events in kids even as Delta has taken over. So we need to pay attention. We're going to have to rely on comparisons to historical controls. But I think that kids are still going to do better with Delta than unvaccinated adults do with Delta, right? It's still helpful to be young when you're seeing a novel virus. You'll hear that hospitalizations are getting younger and younger, but remember that's mostly about vaccination, the fact that we started vaccinating elderly people first. And they used to be at greatest risk of hospitalization. So now that they're all vaccinated, the people who are still left getting sick enough to be come to the hospital are shifted towards younger, but that's not about Delta yet. It may be down the future, we don't know, but there's no reason to think it's Delta. There's good reason to think that's because of the way we vaccinated. Okay, so the key unknowns that I'm looking for at this point as I wrap up, how much can vaccinated people transmit if infected? I think that has a lot, that's important for how we modify our behavior. And the recommendations for masking are driven in large part because of a rise in case counts and the fact that this is still an unknown. I'm really curious to see good data on severity of Delta infection compared to unvaccinated, age-matched controls and comorbidity-matched controls because of its implications, both for kids and for the rest of society. Like, is this a more severe virus in addition to being more contagious? And then I think we've all been looking for data on long COVID in general. There is really still, I think, a limited number of good controlled studies on that at all, and certainly none yet in Delta. Delta is relatively new on the world. So what comes next? This is dangerous to predict. I think cases are actually already declining in the UK where Delta took over first. I think there's very few people who would have both predicted the upswing and then the down correction on this time scale. There's certainly plenty of people who have been predicting one or the other, but both has been hard. It's just really humbling to predict in this pandemic. But it's also important to remember there's a number of factors that go into this. They're testing less. Schools are no longer in session. And they're more vaccinated than we are. So I wouldn't project that. I'm not comfortable saying that's what's going to happen in the US for sure anytime soon. It's also important to remember that things change, that there's some things are stacked in our favor now despite Delta. It's summertime and coronaviruses tend to be seasonal. Things may get worse in the fall and winter. I think that with a virus this contagious, everyone, roughly to a first approximation in the world, is likely to be either infected or vaccinated eventually. And I think once we all have some degree of exposure either to the vaccine or the virus, I think that's how the pandemic becomes a more modest one. I don't think it's through the virus mutating to something less severe, but I think immunity gets us most of the way there. And so I think it's really just important to vaccinate as fast as we can. And this is the reason, these combination of factors are the reason that we've encouraged masking in indoor spaces, even if you're vaccinated. It's mostly driven by high spread and Delta. Okay, so quickly, there were some questions about vaccines that came through the link that was sent out. So I'd say it's never been more important to be vaccinated than it is right now. We have a more contagious virus than we used to, and the levels in some places in the US are as high as they were at our peak. And certainly around the world, this is as important as it's ever been. And I think that your alternative to a vaccine is getting infected with COVID at some point down the line. Remember that about the same number of people now have been vaccinated across the world as have been infected with COVID, and millions have died of COVID. And that's not even close to true of vaccines. There's like tens of deaths from blood clots, but it's a 100,000-fold difference at least. That might be understating it. So please get vaccinated if you haven't yet. In real world observational data, they still look fantastic. And because it was asked, no evidence at all that vaccines affect fertility, affect prenatal development. Again, COVID actually clearly affects birth outcomes. There's no evidence from tens of thousands of tracked cases now of people getting vaccinated during pregnancy that has any effect. And the effect on fertility is essentially based on a flawed scientific premise. That simply, there's no reason to think that would be true and no evidence that it is. So kids, they're at less risk from COVID than adults. I still think that's true. I'm still very eager to vaccinate my kids who are under 5 and 3, but I can't do that yet. And so until that's available, I'm relying on non-pharmaceutical interventions, keeping them outdoors as much as I can. When I can't, masking, distancing, and ideally sending them to settings that are well ventilated, and trying to have them around people who are vaccinated to the extent that that's under my control. That's the best we can do, is know that they are fortunately, because of just their young immune systems, better able to deal with novel viruses, and do our best to protect them from it anyway, even knowing that. So cases are rising, Delta is here, vaccines still work against Delta, but people who are vaccinated certainly can still spread. It seems uncommon, we're still trying to quantify that. And again, vaccinated immunocompetent people remain at very low risk of severe disease, same with kids for different reasons. unvaccinated people and immunocompromised adults are those who are at greatest risk now, and I think need protection as much as possible. And then for reasons like that, we're encouraging masking in common spaces. And so I'm going to stop there.